Practices are finally reopened and the patients are coming in. And we're starting to notice a trend. Patients are either really excited to be coming in and super grateful, or they're on the other end of the spectrum and they're much more fearful and they've got a lot of questions. Regardless of which end of the spectrum the patients are on, how are we ensuring that they're getting a memorable experience during this time of the unknown?
At the Dental MEP, we use science to teach people skills to you. Do not forget to subscribe to our channel and don't forget to hit the bell so you never miss out.
I think that we would all agree that creating a memorable patient experience is one of the most important things that we can do. However, during this time, we don't want these experiences to become memorable because all of the PPE changes and confirmation changes and check-in processes, because it's just really overwhelming and overstimulating. We want these to be memorable because the patients have come to us and had a wonderful experience. We were really in the swing of how we create these experiences, and now we're all trying to follow these standardized approaches for pre-screening, checking in, treatment, and that can really take away from what our patient experience looks like. So in this video, we're going to talk about some ways that we can tailor our patient experience during this time specifically.
Like Chassie said, we really have the swing of things, and now it's about figuring out what's it going to look like. How are we going to create that great, memorable experience for our patients now? The first thing that we can do is try to build off of what we know. So if you know your patients, if you know certain characteristics about them, try to build off of that. If you have the patient who always complained about the text messages that they would get for confirmations, that they're like, oh, why do you have to send me 10 text messages? I hate that I get 10 text messages. Well, I bet that person is really going to hate now that we also have to send them screening questions, that we have to call them again 2 days before, that they have to call us when they get into the parking lot, and then that I have to ask them the screening questions again. So go ahead and manage the expectations for that patient. Make sure that you are accommodating them, that you already let them know that, hey, I know you hate all these text messages. Just know that we're going to be texting you even more. And this is just something that we have to do. Show them that you appreciate them. Show them that you understand who they are as a person. It always feels good when someone says, I get you. I understand you. Even though this is what I have to do, that's a much better way to approach it than allowing them to get really annoyed with the system and saying, too bad, this is just the way we have to do it. So really make sure to customize it to each patient as much as possible.
And we've had those experiences where the patient calls into the practice and they're like, okay, I just got my 5th alert, my 5th reminder. I know that I had told someone to put it in my chart that I didn't want this. So if we can approach it before that conversation exists, to even be able to say like, hey, I know this is frustrating. It's a lot of reminders. It's part of the protocols right now that we have to follow. But I know that this isn't typically how we communicate with you. Just to know that they are seen, that they are heard, that they know that we know their preferences has a huge impact on that experience.
And you have the patients too who typically are trying to get out as quick as they can. If they don't know that this appointment is going to be longer than what they typically plan on, then that's going to be a big disruption in their day as well. What we want to recognize is that there's a lot of emotions right now for people, and everyone's schedules are all over the place. And again, we have patients on both ends of the spectrum. They might just be happy to be seeing people, and they don't care if they're going to be here for 2 hours, 3 hours, 4 hours, whatever it is. I get to see people. It's great. Or you have people on the other end of the spectrum that always wanted to get out of here, hated coming to the practice, and the fact that you're going to add another 15 minutes to their appointment is ridiculous and is going to upset them. And that's okay. But what we want to do is we want to be able to make a good experience for every single person on each end of the spectrum. So try to catch those things in advance. Try to have those conversations in advance so that you can really create those great, memorable experiences for your patient.
Now, as your patient arrives to the appointment, we really want to make sure that we have those expectations for what the check-in looks like and what their process is going to be for getting into the practice, and making sure that they have their temperature screening, the pre-screening questions as well. We made a video called Managing Patient Expectations, so make sure to check that out. The big thing is, as they arrive, we don't want it to feel like a sterile interaction. We want to let them know that we are the same people that have always been here. And typically we smile and they're able to see that. However, we're wearing a mask now. We may be wearing a mask at the front of the practice. So we really have to go above and beyond to make sure that our body language is communicating that we're excited to see them and that they're welcome to come on into the practice. We can do this by smiling under the mask because our eyes are naturally going to show that smile as well, or even standing up at the front desk so they're able to see us. We have to imagine it's a little strange walking into an office with somebody wearing a mask and we're like, do you see me? Am I checking in? What does this look like? So giving a little bit of guidance, which can be done with our body language through greeting them as well.
Yeah, a lot of us have those barriers up right now at the front office. So even that creates like that personal barrier. If they're not used to seeing that, you're normally like right there, front and center in front of them and smiling. That's a different experience for them. So like Chelsea said, standing up and showing them, hey, and waving to them. You know, maybe you can't stand up. Maybe you're on the phone because the next person is checking in. I know those phones are ringing a lot, but still smiling at them with your eyes, waving, giving them that hello, welcome, thank you so much for coming back, giving them that gratitude, being so happy that these patients are back. And then if you can, creating some small talk interaction with them in the meantime, if they're out in front of you, really creating that memorable experience for them where they feel like, wow, okay, they get me, we're connecting, and you're creating that experience again and that connection again that they haven't had for a while.
Now, your patient may have some questions on what has changed, or they may not. I know a lot of times we want to let our patients know that they are reassured and safe, and so we start to tell them all the things that we're doing. This is something, if they're asking and they want that information, it can create an additional fear that was unnecessary if they haven't asked. They may be coming in feeling completely comfortable, and as we start to talk about all the things that we are doing differently to ensure safety, they're kind of wondering, well, am I actually safe with all these other measures that are needed? So allowing them to ask if they have some questions about how we are navigating this time, that is completely fine. Or if they feel like they are not comfortable being seen at this time, that's okay as well. We don't have to agree or disagree with what people are comfortable. That's going to vary for each person individually right now, but allowing our patients to feel heard and that their choices are respected is very important.
Now, we talked about the different ends of the spectrum, and that's also going to happen when it comes to opinions and the situation and what they think care should look like and what it shouldn't look like. It's really important to just kind of go into every conversation as an outside perspective of like, okay, I wonder what this patient feels about this. I wonder what they would like to have happen, and really just allowing it to sit there. Giving patients the space to say, this is what I'm not comfortable with. This is what I am comfortable with. I'm excited to be here. I'm afraid to come in. Asking the question, well, is it safe for me to come in? Wait for that invitation from your patient to be able to say, okay, let me have this conversation with you. A lot of times we're just kind of scripted out right now because it's new conversations for us too. So we might have a script of what we say when we're confirming to a patient, or we might have a script of what we tell them are the safety precautions that we have taken for them, but that could scare them. So waiting for the invitation of that conversation. If a patient calls and says, I'm just not ready, I need to reschedule, I don't think it's safe. If they say something specific like that, as educators, we might go right into education mode and say, don't worry, it is safe for you to come in. Like, you can come in. I've got X, Y, and Z that we've done for you, but just respecting people's opinions and saying, I respect that. When would you like to be rescheduled? And really allowing all those different opinions to exist, and knowing that at times of stress, our patients' personalities are going to be pushed to the limits. So if somebody is normally really comfortable here, they might still be comfortable, or that might have changed, and expecting that. So not expecting every single patient to be adapting the exact same way in the situation.
If we think about the variations in what we're wearing for PPE, this does create a change in the patient experience, and it would be crazy to assume that it didn't. We are wearing N95 masks. We may be wearing level 3 masks over them. We have face shields on as well. So we have to consider that there are some uncomfortable things that we should call out, and it's okay to call them out in an appointment. Your patient may not be able to hear you, and they probably don't want to say over and over again, I'm sorry, I can't hear you. I'm sorry, I can't hear you. But they also can't see your eyes. So just letting them know, I know that I'm muffled under all of this gear. So if at any point you can't hear what I'm saying, please let me know. I do not mind repeating what it is that I was saying. Making sure that they feel comfortable asking, because a lot of times it can feel embarrassing on the other end of that to say, I'm sorry, I can't hear you. I'm sorry, I can't hear you. And also with the additional PPE, it is hot. Like, it is really hot with all that gear on. So being able to say, wearing all of this gear is a little bit more difficult. And so I might not be having as much small talk as I typically have, or as we typically do, especially if it's a patient that you usually have a lot of exchanges with, to let them know this is product of circumstance. This is not any reflection of our relationship that we have now. So being comfortable calling out those uncomfortable things.
There are a lot of things that happen during the time of office closures that maybe our patients are not aware of. Unfortunately, now that we're reopened, they're going to start to experience it and they're going to start to see it. And it could be an uncomfortable conversation. We really want to ensure that our patients are having these great, memorable experiences with us. So it's important to call out the elephants in the room, those uncomfortable conversations, and to really practice them. Though for some of us, we may have lost a team member during this time. And that's an uncomfortable conversation, whether we lost them because of health issues, or we had some people who were pregnant and there's a lot of unknowns, or they have somebody who is a loved one and has health issues, or they were close to retirement and they said, screw it, I'm going to retire right now. Whatever it may be, we're reading that there's a lot of team loss during this time. And your patients are going to come in and they have those relationships and they're going to be expecting to see them. And we're all under the mask and they're going to say, is that you? Is that you? Is that you? And they're going to be looking for them. And it's really important that we're able to have that conversation comfortably with our patient, letting them know that that person is no longer with the practice and that there's not any uncomfortableness about that conversation specifically. Now, the other thing that has happened too is we are backlogged with appointments, especially with hygiene. We've got a few months that we were closed and now we have to try to fit them into our schedule. And however you're handling that in your practice, your patients are going to see that when they're getting rescheduled for their next appointment. Again, making sure that that's not an uncomfortable conversation, that you've practiced it with your team members and friends and family, and that you feel comfortable that this is how you're going to deliver this information to your patient so that they still have a great experience. Now, with team loss, or maybe even just with the closures altogether, there is usually a list of things that maybe we just haven't gotten to. Or there might have been a list of things that this one team member specifically did. And we've been trying to figure out how do we do that and how do we do it well. And so we're playing catch up with all these task lists. And we want to make sure that our patients are not feeling that. Though we may get the phone call from a patient who says, hey, I was supposed to get rescheduled for this appointment. I haven't heard from you guys. Are you even open? And that's one of those uncomfortable conversations where we want to be prepared to say, this is what has happened. Thank you for calling us. We're going to take care of you. And you still create those great experiences. So try to look at the practice, look at the things that have happened, the things that have changed that, if not communicated well to our patients, could create an uncomfortable situation, and practice those conversations and really make sure that you're ready to handle them.
Now, the conversations that are going to happen are going to vary. So I have had patients say, no, I don't want to floss right now because I want to minimize risk. And as silly as it may sound to say, like, actually, the flossing isn't generating as many aerosols as this procedure does, and going into that, there is no harm in saying, if that's what makes you most comfortable, that is something that we can most definitely avoid doing today. That is okay. It's not going to cause harm. Of course, there may be other situations where the education is important for minimizing risk if someone has some advanced treatment that they need. And that is a different conversation, of course. But for those things that can be kind of negated or just accepted as is, It is okay to do so. There are also other conversations that are going to be happening that are good to be prepared for. So I've also had patients come in and say, do you feel safe in the practice? And so that's something, just being comfortable and having those conversations, because it may be on more of a personal level that they're looking for an exchange, not so much what are the policies and the procedures that you have in place. So making sure that we are running through what those conversations look like, how we're able to respond, and how we're able to do so comfortably.
We want to make sure that a memorable experience happens from start to finish, and also that we're creating memorable experiences from head to toe, so that we're not only communicating with our words to our patients what they can expect and what their experience is going to be like, but our body language is showing it as well. Like Chassie said, with all this PPE, we want to be smiling. We want to up our tone of voice. We want to make sure that maybe we're talking a little bit louder because we're muffled behind the mask, that we're really creating still as great of an experience as we possibly can. Make sure to work with your team and talk about what is the experience looking like from start to finish. Where are we maybe losing some connection points and what could we do better? So hopefully during this time where there's a lot of unknown and a lot of new changes, our patients are still getting a really great experience.